Good afternoon mga kabady. Magbibigay lang ako ng konting update tungkol sa COVID-19. Ito ay coming from the World Health Organization. As of March 25, 2020, time 5:53 AM. Meron na po tayong 375,498 confirmed cases po. Dito sa atin sa Pilipinas, mayroon na tayong 552. Tapos yung ating death tolls naman ay umabot na ng 16,362 sa buong mundo. Sa atin, 35. At 196 countries, areas, and territories with cases. So, napakadami na po talaga ng confirmed cases natin. So, nakaka-alarma na po. Very alarming na po yung result na to kasi ang pagdami niya ay napakabilis. Dito na lang po sa atin sa Pilipinas, nag-start tayong mag-lockdown is noong March 15. Ngayon, ano pa lang tayo, March 25. Meron na tayong 552 confirmed cases dito sa buong bansa. Ang hirap ng pinagdadaanan ng buong mundo ngayon. Sabi nga dito, no, meron akong nabasa sa Manila Bulletin News dito kay sa kinakaharap natin ngayon na krisis sa bansa. So, ang ating Pangulo, si President Rodrigo Duterte, nanghihingi na siya ng special power to combat this crisis, itong ating coronavirus disease na problema. Kaya ito babasahin ko lang tong nabasa ko. In a televised briefing, Duterte said, the Bayanihan to Heal as One Act would allow the executive branch to move, decide, and act freely for the best interest of the Filipino people during this health crisis. The Bayanihan to Heal as One Act grants the President additional powers to adopt temporary emergency measures to respond to the COVID-19 outbreak in the country. The new law also gives Duterte the authority to reallocate items in the 2020 national budget for projects that would fight the spread of COVID-19 under the $5 billion emergency fund. Some 18 billion low-income household would receive assistance. So, ito na yung sinasabi natin na assistance from the government. So, magbibigay yung ating pamahalaan dun sa mga nangangailangan, lalong-lalo na dun sa mga, kumbaga, nasa laylayan ng lipunan. So, ayan. Nakakalungkot lang kasi ginagawa na ng gobyerno lahat ng kanilang makakaya. Pero yung tayong mga sumusunod, meron pa rin talagang mangilan-ngilan or madami pa rin talaga ang matitigas ang ulo. Nababasa ko nga sa iba't ibang post sa Facebook yung mga nanawaga na napakasimple lang naman ang gagawin natin, just to stay home. Stay home lang. Pero hirap na hirap tayong gawin yun. Napakasimpleng instruction pero napakahirap gawin. Kung wala naman tayong, kung wala naman tayong kailangan na bilhin katulad ng pagkain, groceries, gamot, wag na tayong lumabas. Yung iba kasi lumalabas, nakikichismis lang, tumitingin-tingin lang sa labas. Ang gobyerno natin gumagawa na ng paraan. Maawa naman tayo sa ating mga frontliners, lalong-lalo na yung nasa hospitals. Yung mga doctors, ilang doctors na ba ang namatay? May 4 na. 'Di ba? Tapos ilan na ang mga nurses natin, na mga frontliners natin na naka-quarantine na rin, na hindi na sila nagfa-function sa ngayon kasi nga and ano na rin sila, PUI na rin sila or PUM na rin sila. So, dito lang sa Metro Manila, no, yung mga hospitals natin dito sa Metro Manila, tumatanggi na sila ng mga patients dahil nga kaunti na lang yung kanilang mga frontliners, iilan na lang yung mga nurses, doctors na humaharap sa kanila dahil nga nag-quarantine na rin sila. Kasi nga, syempre, yung iba nagkakasakit na. So, ayan. So, sacrifice lang sana. Konting sakripisyo lang para sa kaligtasan ng lahat. So, ito naman, may good news naman akong nabasa doon. Kakapost lang doon kay Mayor Isko Moreno. Sabi dito Mayor Isko inspecting 200,000 N95 mask, 100,000 surgical mask, and 2,000 infrared thermometers donated by City of Manila Sister City Guangzhou Municipal Government for frontlines. Oh yes, para sa mga frontliners natin. Siguro i-distribute to sa buong bansa. Napakadami. So thank you dito sa nag-donate na to, yung Guangzhou Municipal Government. Galing, no? So, makikita mo din naman yung bayanihan kahit sa yung mga artista natin, ang daming mga celebrities na tumulong tulad ni Chris Aquino, nagbigay siya ng 25 sacks sa mga tricycle drivers dun sa Puerto Galera kasi nandun sila habang nagla-lockdown, nandun sila naka-stay ng kanyang anak, si Bimbi. Nag-donate siya ng 25 sacks of rice sa mga tricycle drivers. So, di ba, napakalaking tulong yun kasi yung mga katulad ng mga jeepney drivers, tricycle drivers, sila yung no work, no pay eh. Kung hindi sila kakayod, wala silang kakainin. So, thank you, Miss Chris Aquino, sa pagbigay mo ng tulong. Meron din si Angel Locsin, si Pokwang, di ba? Ang dami namang tumulong, ang daming gustong tumulong pa. Kaya nga sabi, tayo din, makipag-cooperate din tayo, tumulong din tayo, magstay lang tayo sa bahay natin. So, habang nakastay tayo sa bahay natin, meron din tayong ito, mamayang alas 7 ng gabi, March 25, praying the Our Father with Pope Francis. So, 7 p.m. Manila time. So, mamaya magdadasal tayo ng Our Father. At meron din tayong Healing Rosary for the World with Cardinal Tagle, 9 p.m. Ngayong araw din na to, March 25. So, magdasal lang tayo. Wala naman tayong, kumbaga, prayer lang talaga ang pangahawakan natin. So, sabi nga ni Secretary Nograles, bahay muna, buhay muna. Stay safe lang tayo dito sa mga bahay natin. Marami naman tayong pwedeng gawin sa bahay eh. Magdasal, it's about time naman tayo na magbasa-basa, tapos mag-reflect, yun. Meron akong ipakikita sa inyong video, ano to siya, this demonstration on how to intubate suspected COVID-19 patient. Panoorin nyo po kung paano ang pag-i-intubate ng suspected COVID-19 patient. So, yun lang po. Stay safe everyone. Mag-ingat po tayo. God bless us.
This video is a demonstration of techniques that can be used to intubate patients with a suspected COVID-19 infection. It's been produced by my friend Dr. Lucas Candler, who's a consultant anesthesiologist in Zurich.
Hi everybody, we are from the Institute of Anesthesiology at the University of Zurich. My name is Vanessa Moll, I'm an attending here. Larissa is a resident and Manila is an anesthesia assistant. We are here today to introduce our airway management concept for COVID-19 positive patients at our university hospital. Our concept is divided in 3 phases. We have the planning phase, intubation and extubation, as well as postoperative care. All these phases are equally important. First, we have the planning, and as you can see, we are all donned in protective gear, which is according to your local SOPs. We did our body check, and we deemed each other appropriate for this procedure. For induction, we have our medications on the tray, as well as our airway materials, including an endotracheal tube with a stylet in place, as well as our video laryngoscope. Next to the induction table, we have our dirty tray for dirty materials to be disposed there. It's also important to have a trash bin next to the patient so you can drop dirty articles right into the trash bin. Outside, we have Tim, who is our clean person and jumper. In case we need medications or airway material, he will be able to hand them to us. We designated our roles clearly, with Larissa being the medication person and airway help, Manila doing the documentation, Tim outside as a clean person, and myself as a seasoned anesthesiologist doing the airway. We are starting with an adequate pre-oxygenation for about 3 to 5 minutes. As you can see, our patient is wearing a surgical face mask, which of course we have to take off. Then we will pre-oxygenate, and here it's important to have a tight-fitting mask to avoid any leakage. After a thorough pre-oxygenation, we are starting our rapid sequence induction. RSI is used to avoid backmasking the patient for prevention of aerosolization. Here, avoiding coughing with a thorough relaxation is also of utmost importance. We induce the patient, and our patient is paralyzed. We are now intubating the patient with a video laryngoscope. We are utilizing an endotracheal tube with a stylet in place. The endotracheal tube now is in place. The stylet can go. Thank you. It's important to inflate the cuff before ventilating the patient. If a patient is desaturating and you have to backmask the patient, it is very important to use both hands to backmask the patient, to have a tight seal, and have a second person, Larissa in this case, to backmask your patient. If the backmasking is not successful, it is important to then reach out to the person outside the room and gather other aids, for example, LMA. If you have to escalate to a fiber optic scope, please use a single-use fibroscope. Intraoperatively, we are utilizing lung protective ventilation strategies, i.e. a tidal volume of 4 to 6 cc's per kilogram ideal body weight and a PEEP. If you're transporting an intubated patient to the ICU, make sure that you clamp the endotracheal tube in inspiration before you disconnect and reconnect to your bag valve mask. We are saving our transport ventilators for use in the ICU, and hence currently we are utilizing bag valve masking for transportation of ICU patients. It is important to avoid coughing when you extubate the patient. Here, IV lidocaine or remifentanil come in handy. When you extubate, you're not utilizing positive pressure, but rather you're deflating the cuff and pulling the tube. We dispose of the tube right away and oxygenate the patient with a tight-fitting mask Once the patient is adequately breathing, we are utilizing nasal prongs for transport. After the nasal prongs are on the patient will also receive a surgical face mask. After successful extubation, it's important to doff your personal protective equipment according to your local standard operational procedures. Again, a body check is important. We also recommend debriefings after intubation and extubation to further optimize your procedure. Hopefully you enjoyed our short video. Be safe and stay healthy out there. Good luck.